Hi, my name is Bailey, and today I'm going to be talking about the female cervix. I have drawn out a little diagram. So we're going to begin with the uterus right here, which is a hollow organ inside the womb, inside the woman's pelvis. And the uterus is going to be connected to the cervix, which is this tube right here between the uterus and the vagina. That's called the cervix. And the cervix is a passageway for fluid to enter in and out through the vagina. And it also produces cervical mucus during the fertile menstrual cycle, and it protects the bacteria and helps opening during childbirth. So that's what the cervix does. And up here we have the internal OS, which is the opening between the uterus and the cervix, and then the external OS is the opening between the cervix and the vagina. And right here we have the myometrium, which is what I've squiggled in right here on each side of the uterus. It is kind of like the muscles that surround the uterine wall, and its main function is to hold the integrity of the vagina and uterus and cervix all together, hold the structure, and it also generates force during childbirth and also sheds the prior menstrual older blood out of the uterine wall. So this is my portion of the female cervix.
So today I'm going to be talking about the crus of penis, the corpus spongiosum, Cowper's gland or bulbourethral gland, and prostate and the scrotum. So first I'm going to start with the crus of penis, and this is they are the proximal projections of the corpora cavernosa. They diverge laterally with each crus attaching to the ipsilateral ischiopubic, and the bulb of the penis is a proximal expansion of the corpus spongiosum. Then the corpus spongiosum is a mass of erectile tissue alongside the corpora cavernosa of the penis, and its function, it surrounds the urethra, and that is the tube through which urine and sperm pass from the body. It contains blood vessels that fill with blood to help make an erection and keep the urethra open during the erection. The Cowper's gland, it is two P-shaped glands in the male located beneath the prostate gland at the beginning of the internal portion of the penis, and they add fluids to semen during the process of ejaculation, and they also produce thick clear mucus prior to ejaculation that drains into the spongy urethra. Your prostate is a small gland in men that makes the semen. I'm sure you've heard of prostate cancer and things like that. It's located just below the bladder in front of the rectum, and it wraps around the tube that carries urine and semen out of the body. It tends to grow larger as you get older, and if your prostate gets too large, it can cause a number of health issues. And last but not least, the scrotum. It is a part of the male's body that is located below the penis. The scrotum is the pouch that contains the testes, the epididymis, and the lower part of the spermatic cord. Let me see. And yeah, that is all.
This is Jessie with Group 3, and right now what I have pulled up here are the testes for the male. In here, what rests on the back of the testes here is the epididymis, and if I just fade this here, you can kind of see it, but this is the actual structure. This just sits, like I said, on the back of the testes. This is where the sperm cells are moved from the testes to the epididymis to mature, and then from here, this is where they pass to the vas deferens and head up to the urethra for ejaculation. So in women, this would, along with the vas deferens and a few other structures, would relate to the Gartner's duct. It serves a similar function, and this is where they diverge here. Okay, so now I have the vas deferens highlighted here. So this is the tube that connects to the epididymis, and the mature sperm is moved from there through the vas deferens here. This is done via muscle movement, and then is passed on to the prostate, and then heads out towards the urethra and the penis. As I mentioned earlier, this structure, as well as the epididymis, relates in the female to the Gartner's duct. It all becomes one system in the female, and specializes for the same thing. So these are the seminal glands, or the seminal vesicles. So here is where the seminal fluid mixes with the sperm, and they become ejaculate, and that's just where all of the chemicals mix together here. This as well in females is also the Gartner's duct. Like I said, it just all forms into one in the female. So from there we have the meatus, which is the very small sphincter that is at the head of the penis, at the end of the urethra. This sphincter is responsible for holding the urethra closed at the end, so that nothing can get in or come out, of course, controlling continence and such. In terms of reproduction, the meatus opens for ejaculation. In females, it's the same. It's just the meatus in females is just part of the urinary tract. It also just holds closed the urethra, and then opens for urination, of course.
Alright, so today I'm going to go over the testes, the foreskin, glans penis, shaft of the penis, and the corpus cavernosum of the penis. So we'll start with the testes. So here, so they are going to be, if we hide everything else, inside the scrotum. So you can see inside there. They're the male reproductive glands found in the scrotum, comparable to the female ovaries, produce hormones like androgens. It's also where sperm is produced. All right, next we're going to do the foreskin prepuce, and it is going to be right here on the glans penis. Let's see. We'll just do a left and right so you can see. So it's a double little layer of loose retractable skin at the end of your penis. In females, this would be like the clitoral hood that surrounds the clitoris, and this just provides some protection. All right, so we're going to do the glans penis. So we'll just hide those. those. Alright, so then you see the glans penis, both halves of it. The head or tip of the penis, where the opening of the urethra is located. In females, this would be the clitoris. Let's see. Next, we're going to do the shaft. So here, and that's going to kind of go with the corpus cavernosum. So the shaft of the penis contains like 3 erectile tissues, 2 corpus cavernosa, and a corpus spongiosum. And the urethra also runs through this. So real quick, we're going to do the corpus cavernosum. Alright, so this is a cross-section view of the penis. And here we have the corpus cavernosum. So it's a pair of like sponge-like regions that contain most of the blood in the penis during erection. In females, the corpus cavernosum clitoris is the body of the clitoris that contains erectile tissue. And you can see that also, they've shown it here for comparison. And this runs the length. All right, thank you.